the VA developed the shingles vaccine, first implantable cardiac pacemaker. You know, they publish about 10,000 research studies a year, and all of that would come to a grinding halt.
Which side are you on? Which side are you on?
We've got Suzanne and Steve in the Zoom, right?
I know we've got Suzanne.
Perfect.
We'll see about Steve. And I wanted to introduce them real quick because they reached out this week. We've been having some dialogue, and I've been reading their stuff and really impressed. Suzanne Gordon is Senior Policy Analyst at the Veterans Healthcare Policy Institute and the author of many books, most recently Wounds of War, How the VA Delivers Health, Healing, and Hope to the Nation's Veterans. Steve Early is a freelance journalist, labor organizer, lawyer, and the author of most recently Refinery Town, Big Oil, Big Money, and the Remaking of an American City. And his work has been in New York Times, The Washington Post, The Nation, among others. And they also just had a great article out in Jacobin. Corporate politicians are privatizing the VA, the crown jewel of socialized medicine. So definitely want to check that out, folks.
Yeah. It's really great. And this is their new book that we're going to be talking to them about this book later because this debt limit stuff is a little bit more timely. But
right, yeah.
But if you are interested in a book about veterans issues and stuff like that, you can take a look at this book, Our Veterans, Winners, Losers, Friends, and Enemies on the New Terrain of Veterans Affairs. And some of the work in that book, as I understand, is based on a report by the Veterans Healthcare Policy Institute and the National VA Council of AFGE, my union, the American Federation of Government Employees, right here. So if you want to check those out, highly recommend it. So Suzanne, welcome to the Valley Labor Report. Appreciate you taking the time to join us this morning.
Thank you. Unfortunately, Steve was not feeling well, and so I'm standing in for him. So I'll be talking for both of us, but thank you so much for having me and in absentia him on it.
Absolutely.
Happy to do it. Sorry he's feeling under the weather, but glad I'm sure that you'll be able to elucidate these issues greatly for us in his absence. And so first off, let's we're a union radio show, right? We're both members of unions. We have been for years. Adam for probably more than a decade now. He's been a member of one union or another. Me, I'm coming up on half a decade in the labor movement. We have both held various offices in our unions. And so your work really kind of centers around veterans and veterans issues, but especially with some of these last few things, they've really been intersecting with labor issues, and you've been making that point explicitly. And so how do you see the relevance of veterans affairs to labor?
Well, to be a veteran, you have to have been working for the U.S. military. And so the issue of labor and how work impacts human beings is central to veterans. And the veterans benefits that we've just been talking about, that they've been talking about when this whole thing, the whole debate about and controversy about the debt ceiling is occurred, is all about the impact of military work on human beings who then become veterans when they leave the military, because you can't get veterans benefits if you didn't do this work, and often if you weren't hurt by this work. So all the benefits, like the veterans health care that they've been talking about, that the Republicans wanted to cut or would have cut without Democratic pushback, is also related to military work. And then, veterans also, and this is something that has been entirely missed in the discussion about the debt ceiling, veterans don't just work for or benefit from one federal agency, the Department of Veterans Affairs. They work in many agencies that would be impacted by a government shutdown or cutbacks in government services. 100,000 veterans work in the post office. Veterans get a veteran preference for government hiring. They work in the EPA. They work in Homeland Security, et cetera, et cetera. So, and also the other thing that is really disturbing is in this focus on veterans benefits, like from the VA, and certainly from the Veterans Health Administration, which is the health, healthcare system that we have set up as taxpayers and funded for the past almost 100 years to serve military veterans. Only about 9 million veterans are enrolled in the VA because other veterans are not eligible. So cuts in Medicare or on the state level, Medicaid really impact veterans all over the country. And then veterans don't live in little veteran-only bubbles. They have family members and friends and communities that depend on government services. So I think this whole debate about, the impact on veterans is really narrow. And then, although I'm a big advocate for helping veterans and delivering excellent services to veterans, cuts in the VA would impact all of us. The VA teaches 70% of American physicians in training. It does research that impacts all of us. It has a mission, a fourth mission to serve in help as a backup to the civilian health sector in medical and in national emergencies. So, as usual, the framing of these issues is very conveniently narrow. And then, one has to ask, veterans signed up to quote unquote sacrifice for their country. Do they want to see their country, the country's economy demolished by right-wing Republicans who, just have absolutely no agenda aside from, destruction. So it's a very interesting issue.
Yes, absolutely. And that's a very good point about, broadening out the issue in multiple ways. For one, like you said, the Veterans Affairs is not the only government agency that has relevance to veterans because they're employed all throughout the government at a very high rate. And so cuts to any federal agency is going to actually disproportionately affect veterans. And then also, veterans are part of other people's families. And if something hurts them, it's going to hurt the rest of their family and their friends and their community and all this stuff. And that's all very important to understand. But narrowing it down again to the Veterans Affairs, you mentioned in the article in Jacobin that the Limit, Save, Grow Act has a proposed cut to the Department of Veterans Affairs of 22%.
Yeah, right. It's right. It would be 22%. And the Republicans have already constructed a series of legislation that unfortunately many corporate funded Democrats have signed on to, called the VA Mission Act, that outsources veterans care to the private sector. And so we already, the budget that we have allocated to the VA healthcare has already been depleted by almost 50% because now much of it goes to private sector providers, not the VA. So if you have depleted the budget by 50% and then you add on to that a 22% cut, you can't just look at, the 22%. It has to be considered on top of the over 35% that is now going out of the VA to private sector providers to take care of veterans. And these providers don't know anything about military cultural competency, about veterans' complex health conditions. So this act, the Republicans were constantly saying, "Oh, no, these cuts aren't going to impact veterans." Well, once again, they look narrowly at which veterans and where these veterans live and work and what services they depend on. But they also conveniently excise from their calculations the damage they've already done. But the reality is that these people are wrecking balls. They have no positive agenda. We see this in VA healthcare, where they have initiated a series of outsourcing outsourcing legislation over the past since 2014. And the studies show that when veterans go to private sector providers instead of Veterans Healthcare Administration, that they really suffer because these providers don't provide the kind of high quality coordinated care the VA does. So it's you have to really understand the broader picture of what is happening in Veterans Affairs.
Right. Yeah, absolutely. And this 22% cut on top of, like you mentioned, all the other cuts, this is going to affect people on both sides of the issue in Veterans Affairs, right? It's going to mean people people go without services, whether that be healthcare or other things that the Department of Veterans Affairs administers. I mean, I would assume that they administer other benefits than healthcare, like college funding and stuff, right?
Well, also, many veterans depend on pensions administered by the veterans of the VA, and also compensation for service-related injuries. And so their incomes, I mean, if you are 100% disabled veteran, like some of my friends are, you are going to be dependent on that check coming from the VA. And if you don't get that check, you're going to be really out of luck. And there's just, also VA research, there's ongoing VA research. The VA is doing research into prostate cancer that veterans suffer from, into COVID, into long COVID. And, not only veterans depend on the outcomes of the research and the treatments that they develop. I mean, the VA developed, almost nobody knows that the VA is the second largest after the National Institutes of Health research powerhouse in the country. And the VA developed the shingles vaccine, the first implantable cardiac pacemaker. They're doing research in they publish about 10,000 research studies a year. And all of that would come to a grinding halt.
Suzanne, I thought that the only place that innovation came from is the private sector. What is this about?
Oh, really? You mean it doesn't come from the government at all?
That's what people tell me. That's what people tell me.
I guess I have to look into that.
But yeah, I mean that's such an important point.
I forgot about that.
Yeah, I mean, but what you're saying is such an important point that they really do a lot of good stuff, and I didn't know that about the VA creating the shingles vaccine. I mean, that's incredible.
Well, it was the first shingles vaccine, the nicotine patch, the first implantable cardiac pacemaker, barcoding in hospitals. You can just go on and on and on. I mean, if anybody's interested, they can. I would really encourage people to go to the website of the Veterans Healthcare Policy Institute. We have a whole rash of studies that show that the VA delivers much better care to veterans than the private sector does to those of us who aren't veterans. And very few people know, for example, that the VA pioneered the integration of primary care and mental health care. So most of us, when we go to the doctor and we say we feel depressed, they refer us to a psychologist or a psychiatrist. And the VA, and then you may or may not, make the appointment. You may or may not go to the appointment. In the VA, if you say you feel depressed or anxious, they walk you down the hall and introduce you to a psychiatric nurse practitioner, psychologist who's right there on the premises. Right. This model really has been documented to be much more effective than the sort of referral model. And the same is true, if you have a problem with taking your medications, they walk you down to a pharmacist. Or if you need help with your diet because you're trying to deal with, diabetes or obesity, they walk you down to a dietitian. None of this happens in the private sector. I mean, they have social workers. They have multiple social workers involved in primary care practices. At UCSF, University of California, San Francisco, they have 28,000 patients in their primary care practice, and they have one social worker. At VA, in a small primary care practice, they'll have like, I don't know, 10, whatever. It's that we have been, for the past decade, we have been bombarded with negative messages about the VA. And it all ties into this debt crisis issue, because we've been bombarded with negative messages about government from Koch brothers and dark money, right-wing funded billionaires, organizations that they fund. And they don't want us to believe that government can work. And they, bombard us with messages. They defund institutions and agencies like the VA, and then they want to defund the whole government to make sure government doesn't work, by just having it not be there at all. And this is a strategy that is killing people, literally, quite literally killing people.
Yeah, and I mean, it really is a kind of self-licking ice cream cone, right? You say that government doesn't work, so I'm going to cut government, and then, look at that, government is even worse. Now I'm going to cut it even more. And it's totally a lot of these, to the extent that there are issues in government services in the VA, a lot of it is really just manufactured by underfunding and by lack of support for these agencies. And so,
sabotage.
Sabotage. And so in that context, I mean, what do you make of the right's overtures to veterans as they are doing all of these things to destroy services that they rely on, to destroy their ability to have a good job after their service? While they're doing all of that, these politicians are going around as if they are the ones that care about veterans, and everybody who's not a Republican hates veterans.
No, absolutely. It's a huge hypocrisy. I mean, hypocrisy is an understatement. These people send young men and women into unnecessary wars that give them the healthcare problems and economic problems and so forth that that make them dependent on the Department of Veterans Affairs. And then they cut the Department of Veterans Affairs so that they aren't helped. And, it's really fascinating. If you go back to, for example, 2014, where Bernie Sanders introduced a really sweeping and comprehensive bill to improve the Department of Veterans Affairs that was supported by all the major veteran service organizations. That bill was opposed and killed. It wasn't even brought to a vote by John McCain and Republicans. And they got up on the floor of the Senate and had the temerity to make the argument that our veterans would not want to pass this bill to help them because it would cost so much money and it would hurt people in the future. I mean, these people have no shame, and, tragically, they, even this, we see in this debt ceiling discussion, we're going to exempt the military from cuts. Really? And their support of these huge military budget deprives veteran families of the ability to fund education, their kids' education, to get good housing, to get out of debt. And also, their opposition to national health care and to free education or loans to people so that they're not saddled with debt for the rest of their lives. It just, creates poverty and impoverishment in the communities from which military service members are recruited. And most people enter the military today. The vast majority of people who go to enter our all-volunteer army do so because there's an economic draft. And even the military understands that if they didn't offer free education and healthcare, nobody would join up because there's a very limited amount of people who want to spend, their late teenage and early 20s years, fighting the bad guys.
Right.
And so it's really, but tragically, I'm 77 and I've lived long enough. People are very divided and they often don't connect the dots and they're swayed by emotion. And so these right-wing politicians, appeal to veterans for a lot of the wrong reasons. And, the military doesn't teach people to be critical thinkers. The military deliberately breaks you down and builds you back up. So you'll do what? Kill other people, which you're not supposed to do,
Right.
and obey orders and think in black and white terms. And so it's not surprising that a lot of veterans are bamboozled by these folks who, make all kinds of promises and really ignore their real needs, and often not just ignore their real needs, but destroy their communities.
And I mean, and I think that we can, one of the things that we can point to is that, maybe to a certain extent, it's not even necessarily that they're being bamboozled, but that the opposition for their issues are not much better. You mentioned that, a lot of these corporate Democrats are going along with some of these privatization things of the VA and the destruction of the VA. And so in a lot of cases, really the opposition to some of these proposals is not that much different. And so as much as it's a critique of the Republicans, it's also an encouragement to the Democrats to say, you actually have to put forward a positive vision for how you can, protect veterans and enable them to survive and thrive post-service.
Absolutely. I mean, the Biden administration is a perfect example of this. Biden's VA Secretary, Dennis McDonough, has done absolutely nothing to reverse Trump-era policies that have helped to decimate the Department of Veterans Affairs. Absolutely, almost nothing. And he has continued with Trump-era outsourcing of veterans health care and really accelerated it, I would argue. He has done nothing to we at the Veterans Benefits Administration talk about labor issues. One of the things we mentioned in our report, disadvantaging the VA, how VA staff view agency privatization and other detrimental policies. The Trump initiated the outsourcing of very critical exams, which are used to prove whether vets have a service-related health condition. He outsourced them from knowledgeable VHA, Veterans Health Administration clinicians, to private sector contracts over which there's very little oversight. And he has also continued. So now 90% of comp and pen exams are done by the private sector, and Biden administration has done nothing to stem this problem. The administration has imposed or continued punishing productivity standards on claims processors who work in the Veterans Benefits Administration. So they can't really, most veterans don't just have one health-related problem for which they make a claim for compensation. They have many. And you need a lot of time to talk to them and explain things to them. And they limit, the talk time that these people have with veterans. And they're punishing productivity standards. And the Biden administration has done nothing to reverse those. Biden, really, in my view, illustrates this problem of the consensus, the anti-government consensus, really, among many corporate Democrats who are, bought and paid for by big pharma. I mean, somebody like Debbie Wasserman Schultz, she is like bought and paid for by the hospital industry. So she has no interest in real oversight or adding enough appropriations or fighting off the closures of VA facilities, because, the people that pay her to be elected want veterans, they want veterans as patients, even though they don't have the hospital beds or the staff to accommodate those veterans. I mean, one of the great ironies of this whole issue of outsourcing is that our healthcare system is broken. We can't even, private sector, healthcare sector, can't even take care of the patients like me that are, have private insurance or lucky enough to have private insurance.
Right.
We have a primary care crisis, a mental health crisis. Most of America is primary care and mental health desert. There is no place for these veterans to go outside the VA. But the Republicans don't care about that. They don't really care about that. And a lot of the Democrats don't do their homework. And, many staffers on Capitol Hill, tragically, know very little about the VA, and what they know they get from the news. And the corporate news, the New York Times and Fox News are not that far apart in their coverage of VA issues and veterans issues.
Suzanne Gordon is author of the recent piece in Jacobin, Corporate Politicians Are Privatizing the VA, the Crown Jewel of Socialized Medicine. She's also the author of Our Veterans, Winners, Losers, Friends, and Enemies on the New Terrain of Veterans Affairs, and is the Senior Policy Analyst at the Veterans Healthcare Policy Institute. Suzanne, thank you for your time this morning. I appreciate it.
Thank you for having me.
Thank you so much. And we'll have you back on to talk about the book.
Thank you. Take care.
Appreciate
Bye.
it.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.